everyone. I'm Ashley Bassett,
And I'm Catherine Logan.
and welcome to another episode of Game Plan. These Game Plan episodes are specifically designed for patients to hopefully answer some of the questions you have about the most common sports medicine conditions, what the diagnosis and treatment looks like, and what the recovery looks like. We are supported by Stryker. Seeking a clinically proven solution for your patients with massive and irreparable rotator cuff tears that has the potential for early functional recovery and pain relief? Check out InSpace.
InSpace is the industry's only minimally invasive biodegradable subacromial balloon spacer for the arthroscopic treatment of massive irreparable rotator cuff tears. InSpace is designed to restore the subacromial space without requiring sutures or fixation devices. Learn more at stryker.com/InSpace.
Today, we're focusing on hamstring injuries in the NFL, specifically risk factors for hamstring injuries, treatment options for these players, when can they expect to return, and more importantly, what do they perform like when they return?
So first, let's talk a little bit about the hamstrings in general. So the hamstring muscle group is made up of three large muscles all on the back of our thigh. So we have our semitendinosus, our semimembranosus, and our biceps femoris. So these muscles span from the ischial tuberosity, which is basically the bone we sit on, down the back of our thigh, and then cross the knee joint before attaching on the outside of our knee. The primary role of these muscles is to both extend the hip as well as bend the knee. And importantly, as far as regards to sports, they aid in deceleration.
So talking a little bit about stats, epidemiology of this injury. So it's the third most common injury by anatomic location in the NFL, and it's the most common injury among pass catchers in the NFL because of their positional demands and their physiologic makeup. More on this in a little bit when we talk about risk factors for injury. So muscle strains in general are graded according to their severity. So a grade 1 strain is a mild injury. It's often described as a pull, and they heal pretty readily. A grade 2 injury is a partial tear, and a grade 3 is a complete tear of the muscle that may take months to heal. A recent study looking at hamstring injuries in the NFL found that the vast majority, 88%, were grade 1 strains, followed by 11% that were grade 2 strains, and then only 0.6% were complete grade 3. So those are pretty rare. Mechanism of injury for hamstring is usually in the sudden takeoff phase of running, and 82% of these injuries in the NFL occur by non-contact mechanism, which makes sense. Most occur at the proximal myotendinous junction. So what that means is it's up where the muscle belly meets the tendon, kind of up higher near the pelvis.
And so risk factors. So why do these things happen? So risk factors for hamstring strains include muscle tightness, strength imbalances, meaning an imbalance between the quadriceps and the hamstring, muscle fatigue, as well as lack of sufficiently warming up. So these are things that strength and conditioning team members in the NFL work really diligently on to modify. But we also talk about non-modifiable risk factors and what should we look out for. So things like that are non-modifiable are position. So wide receivers and defensive backs. So sprinting athletes, they have a higher percentage of those type 2 muscle fibers, which have the benefit of quicker contraction and greater power generation, but also less blood flow than type 1 muscle fibers, which predisposes them to micro tears or strains of the hamstring. And frequent stop and start nature of these respective positions can also create fatigue in the muscles, ultimately leading to a strain. Other things to think about: older age. So average age of the NFL player that has sustained a hamstring is about 27 years old, which is, for the NFL, old. So by that time,
it hurt me a little bit when they were like, those old 27-year-olds are tearing their hamstrings.
A little bit, but
exactly.
So by the time they're getting to their late 20s, so many of those physiological factors like testosterone, strength, and bone density have peaked. Last thing to think about as far as a risk factor is prior injury. So we'll discuss this a little bit more with recurrence, but something to kind of bookmark for now.
So once a player injures their hamstring, the next step is often an MRI. You always hear about this. They're carted off the field or they hobble off the field and they're getting an MRI the next day to look at their hamstring. And this is despite the fact that hamstring injuries are typically a clinical diagnosis. So why are so many people getting an MRI? Well, an MRI can give more detailed information about the injury, including the specific anatomic location, the number of tendons involved and the muscles involved, and the cross-sectional area involved, as well as the extent of the tear. And there has been an interest in trying to correlate certain MRI MRI findings with time to return to play in an effort to predict how long a player will be out. And we can understand why that's really exciting, but this is also quite controversial. Some articles have shown an ability to correlate MRI findings with time out and return to play, while others that have looked at these kind of grading metrics have found no ability to correlate it with time lost. So one of my mentors, Steve Cohen at Rothman, he looked at this and he found that rapid return to play, which is less than 1 week out from your initial injury, was associated with isolated long head of biceps femoris injuries, which we will put a depiction here. The long head of biceps femoris is one of the hamstring muscles, and tears that involve less than 50% of the muscle with minimal swelling. So essentially a grade 1 strain. More prolonged return to play, so greater than 2 to 3 weeks missed, was associated with tears that involve multiple muscles, greater than 75% muscle involvement, extensive swelling. They were further down into the muscle belly itself versus being at the junction of that muscle and tendon that we spoke about at the start, and grade 3 strains, which are complete injuries. So a follow-up study looking at this found that this was unreliable to predict return to play. But interestingly, people always quote that, but this comparison study by Hamilton et al. Looked at use of this grading system in soccer players, not football players. So I still think this holds some utility. Not that this kind of information is out to the general public, knowing exactly how many tendons or muscles are involved, but it's just interesting to know. I do think that there is some correlation with the extent of injury and how much time we can expect a player to miss.
Yeah, and obviously all this data is so important when we're talking about, a week missed is a really big deal. So trying to
Yeah,
target what is their return to play, what's the expectation is super important so that data becomes a bigger deal.
exactly.
So let's talk a little bit about treatment recovery timeline. So what can we expect when this happens? So the mainstays of early treatment, rest, ice, NSAIDs, or over-the-counter medications, followed by stretching and strengthening. Mainly the goals are to correct any muscle imbalances with the quadriceps. And then there's other things that are working on the soft tissue. So massage, ultrasound, electric stimulation. Those kind of modalities are sort of an adjunct add-on to sort of help reduce some of the symptoms. But the reality is these things can take 6 weeks to fully heal. So can we speed that up? And I think the answer to that is really maybe. So PRP, or platelet-rich plasma, we always see it in the internet, quote unquote, stem cells, not really stem cells, but just what is PRP and how do we think about that in the setting of these hamstring injuries? So Dr. Jim Bradley and colleagues at UPMC, so Pittsburgh, they have reported probably the largest database as far as PRP injections with hamstring. What they found is that PRP injections allowed for faster return to play in athletes with grade 2 hamstring injuries and with a 1-game overall difference. So this is a big deal in the NFL.
Mm-hmm.
There was no difference in total days missed or time to return to practice, though. So as far as that timeline, there is a study in the NFL players over a 10-year period. So 41% of players with a hamstring strain returned in less than 1 week, and another 41% returned between 1 and 3 weeks. So only 18% of these hamstring injuries lasted longer than 3 weeks. Their overall average missed time across all levels was 13 days. So this study also pointed out in the first 2 weeks after hamstring injury is the highest risk of re-injury. So some of these athletes are just not ready to return, and we have to have a lot of caution then. So I'm going to let Ashley talk a little bit more about recurrence, but something to look out for.
Absolutely. So I think that's really important to kind of talk about recurrence and what can potentially predispose that, right? Not just for our fantasy teams, but also for the team and caring for the athlete as well. So we've all seen that player that has had a hamstring injury. They rehab, they return in 2 weeks, only to be sidelined a week later. And so, are there certain risk factors for re-injuring a hamstring? And the answer is yes. So the paper we referenced earlier nicely identified several risk factors for recurrence. The first being shorter time to return to play, and we're going to put a nice graph up that shows this. They found that the greatest risk of re-injury was when players returned within 2 weeks of their initial injury. And like Catherine mentioned earlier, older age and longer playing experience is also a risk factor for hamstring strains in general, but also a major risk for recurrence. Other aspects that were found to be risk factors for recurrence in that study were sustaining their initial injury in game rather than practice, lower BMI, and wide receiver positions. They were all risk factors for sustaining a re-injury in the same season. So to go back to that shorter time to return to play, it's kind kind of like, how do you balance it? The majority of hamstring injuries return in less than 1 week, 41%, and then another 41% return in less than 2 weeks. But that also increases their risk of re-injury. So how do you balance that? I don't know that we really know that answer, but at least we can say that the vast majority of our athletes that have hamstring strains, we can expect them to get back pretty soon after their injury, barring it being a full thickness injury or needing a PRP injection or, needing more extensive rehab or even surgery.
Right. And I think there's a difference between returning to practice, and maybe that's part of the solution, returning to practice before returning to a game so that you can sort of have those test runs, because we can see in the data that the injury recurrence is happening in game rather than practice. So maybe there's just a little bit more time in the practice setting. The lower BMI, I don't know. I don't get that. Why is a lower BMI part of the recurrence risk? I have no idea.
Yeah,
Um,
I don't. I mean, it's odd. Maybe they're more. I don't know. Maybe they're faster. I was thinking that
yes.
wide receivers that are smaller BMI, maybe they're faster and they can make their way up and down the field quicker, and therefore they're predisposed. But yeah, I mean, I'm thinking back to the athletes that I saw with hamstring strains during my 1 year fellowship when I was
Yeah.
working with the Eagles, and they were all on the thinner, smaller side that
Yeah.
sustained the hamstring injuries, at least in the wide receiver sprinting position. So it is interesting.
Yeah.
Yeah.
So, well, maybe drop a comment if you have some ideas. But I
Yeah.
think maybe, sort of the speed has something to do with it. But yeah, I think
Yeah.
overall good things. It's not a huge amount of time to be out of games, but, it
Mhm.
certainly takes someone down for a few weeks.
Absolutely. And then one thing I think that we didn't mention, we mentioned performance at the start. And so just to kind of highlight that, performance metrics have shown that while they're less reliable getting back in, as we said, they have a high rate of going back out if they get back in within 2 weeks. And often teams will manage their snap count, so won't have them in full go because they're trying to preserve that health and ease them in, as Catherine alluded to, ease them back into playing so that they're not full go. Once they do play, their performance metrics equalize. So if this athlete can get back, or if they had a hamstring strain last season, you know that you can trust them kind of moving forward.
Yeah, good news.
Awesome. All right, well, awesome. Well, thanks everyone for listening to this episode of Game Plan. We hope you enjoyed our conversation today. So make sure to follow us on Apple Podcasts, Spotify, Amazon Music, or wherever you get your podcasts to stay up to date and make sure you never miss an episode. If you like what you hear, please consider leaving us a review. You can also find us on YouTube. Remember to subscribe to keep up with those videos. You can reach us by email at thesportsdocspod@gmail.com. Find us on Instagram at thesportsdocspod, and Twitter, or X, whatever we're calling it nowadays, the Sports Doc Pod, no S. We love your feedback. Stay fit, friends.